each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. Happy TGIF Friday. And as this time of the year, all the time, a lot of New Year's resolutions, which I have to imagine the top one is losing weight in America with obesity. But that's why I definitely wanted to have on the show a general and bariatric surgeon. Well, I believe he does more bariatric surgery nowadays. He's busy with that. Dr. Fernando Bayron. Dr. Bayron, welcome to the program.
Hello, David. How are you?
Thank you.
It's great to be here again.
I appreciate it. I know you're a veteran of this radio show. You've been on a few times.
Yes.
So let's get right into it, and then we'll talk a little bit more about the sponsor a little later because I don't want to waste any time. So one of the things that I've come across in my journalism the last few years is the term body mass index and the acronym BMI. What actually is that term? What does it mean?
So, David, the BMI is a term, it stands for Body Mass Index, and it's a measurement we do of people that take into account their height and their weight, because that is the only way to compare people. I mean, if you take, say, Shaquille O'Neal, he may be 280 pounds, but he's so tall that his BMI is really very low. I suppose that if you were 5 foot and 280, you would be severely obese. So you cannot measure obesity in terms of weight only. You need to account for the height, and that's called the BMI, Body Mass Index.
The Body Mass Index, and that's a good point. And it's amazing with Shaquille O'Neal, just seeing him nowadays in the commercials. I can't believe that he's able to stay in shape, because it's really an anomaly. I mean, you've seen it firsthand. Most of America is out of shape, and once you're out of shape, sometimes diets don't work. Sometimes working out, as much as you do it, don't work. A lot of it, and we're going to get into it, has to do with not only genetics, but the way we eat, what we're putting in our body, and that's where you come in. So I know that you specialize in different types of bariatric surgery, but one of the things you're an expert in nowadays is the revision for bariatric surgeries. Maybe someone had a surgery years ago, and for whatever reason it's not producing the results, or maybe needs to be redone. So tell us a little bit about revision bariatric surgery, because I'm just hearing about this. This is new to me.
Well, it's getting more popular now, but it's something that we've been doing for some years. We know as a fact that bariatric surgery is the best way to lose weight when you are severely overweight or obese. But obesity is a disease that is genetic, is prevalent, you have it on you. And we always tell our patients that with the surgery, we only control the obesity. We don't cure. Obesity is never cured. So as the years go by, and you may go back.
Oh, you're good. We're just messing with the microphones.
as the years go by, and you may go back to your old habits in some cases, or just because the disease takes over, your genetics don't help you lose weight, you may regain the weight. And it's very common for us to see people that had surgery 6, 7, 10 years ago and did wonderfully, were off medications for diabetes and high blood pressure, and they slowly start increasing weight. And it becomes a problem when the morbidities starts to appear again. When the patient was diabetic, he got cured by the surgery, he gained weight, and it comes back. But we have surgeries to address that. There is a solution for that. It's like a touch-up.
A touch-up, yeah. And now one of the things, last time I was in your office, when I believe you were over in Sunrise at the time, we talked with a married couple who had their bariatric surgery by someone else, a different doctor. I know a doctor you know very well, but I think it was like 15 years before or something. Correct me if I'm wrong. And then you did the revision surgery on the husband and wife?
Yes. That is a very nice and interesting couple. Yes, I met them several years ago in follow up after their bariatric surgeon retired. I followed them for some years, and they had fantastic results the first time around. But it lasted like 7 or 8 years, and they slowly, because of a combination of their disease and their losing the tight control that they had of their diet, regain their weight. When a situation like that happen, we have to revisit all the aspects because, I mean, I'm telling you that I can do surgery again for them, but it's not the only thing. It's not a magic fix, just like the first time. So on those patients, we start by sending them to the dietitian, re-educating them on the things that they need to do to keep healthy, having long and profound conversations about their personal situation, what's happening in their life that is making them change, and go to the psychologist. And when we feel that they're ready and they're complying with everything, we offer them surgery. And if they follow through, they do fantastic. This couple you are talking about, I just saw them 2 weeks ago, and they're doing awesome. Their diabetes, both of them had diabetes. It went away. One of them had to have a knee replacement. He had it recently, and it was excellent. He was back in his very demanding physical job a few weeks after the surgery, because when you lose your weight, it also helps you recuperate from any of the physical maladies. If you need a knee replacement or have arthritis, you're going to get better if you don't put so much weight on those knees. So this couple were the perfect example. They lost the weight with the revisional surgery after they went through all the process. And the thing is that you talk to them now about their diet and their physical activity, and they're exemplary. They're eating very healthy. They are doing exercise together every afternoon, and they're doing very good.
That's important. I remember they had children too, which kind of helped them to see the reason why to do such a great measure, for their health. And now, another thing that we should mention is when people need certain surgeries and they're overweight, sometimes it's a prerequisite for people to lose weight to have certain surgeries. So bariatric surgery can also help with that, because I know just in talking to people, sometimes people, they weigh too much and they can't have the surgery that they need.
Yeah,
so,
for many reasons. One of our main referral sources is, as I mentioned before, orthopedic surgeons. Mm-hmm. Why? Because if you do a knee replacement or anything in the lower extremities on a patient that is severely overweight, they won't get better. Those knees cannot handle that weight for long, and the knees will be hurting soon again. So every day, more often than before, they're sending the patients pre-op. In fact, the case I'm doing Monday is a case like that. Somebody that needs a bilateral knee replacement, and she's having the bariatric surgery as preparation for the knee replacement.
Well, beforehand.
Yeah. So another thing that is very commonly accepted now by surgeons, we operate a lot on the ventral hernias. Mm-hmm. The problem with the ventral hernias is that when you do a ventral hernia in somebody that is severely obese, the chance of that hernia coming back is like 50%.
Oh, no.
Because the weight of the abdominal wall weights on the repair and breaks it. So now it's kind of an accepted practice, or the standard of practice, to have the patients that are morbidly obese get weight loss surgery, allow them to lose significant weight, and then do the hernia surgery.
And we're here with Dr. Fernando Bayron. He's a bariatric surgeon and general surgeon with Tenet, Florida Physician Services in Fort Lauderdale. You moved your office from Sunrise, now you're over in Fort Lauderdale, right?
Yeah, we are now on campus at the Florida Medical Center campus. Is at 4900 West Oakland Park Boulevard.
Suite 101.
Suite 101.
And I got the number here, 954-472-1322. or you can type in drfernandobayron.com online, and you can get all this information as well. Or tfpsdocs.com is good too. You can search for him there. Now, are you medical director of bariatric surgery at the hospital?
Yes, I am.
Oh, wow, you're the medical director.
For many years now. We have our program at Florida Medical Center has been open since the 90s. Actually, the first laparoscopic gastric bypass in the state of Florida was done by our program. I wasn't there yet, by Dr. Carlos Carrasquilla in the 90s. And that program has been successful forever. We have been a center of excellence or a certified quality bariatric program since the certification for centers of excellence was created early in the 2000s. So at the present, we have 3 bariatric surgeons with a very busy schedule.
Wow, 3. I don't think I've seen a hospital with that many. And I'm actually sharing this to Facebook Live as we speak. You can always get this or any of our shows on All County Healthcare Incorporated, INC. Just type that into the search bar, and you'll be able to get this show anytime that you want to take a look if you missed anything as well. And I just shared it to my Facebook page. I just had to take the time to do that. And again, we're here with Dr. Fernando Bayron. We're talking bariatric surgery, general surgery, and bariatric revision surgery, which is new to us here on the radio show. I don't think we've ever talked about that as well. Now, talk a little bit about some of the weight loss surgeries you do. These are before revision. Say first time. What are I know is bypass one of them?
Yeah. Nowadays, basically, the surgeries that are accepted are the gastric bypass and the gastric sleeve. Those are the most prevalent. The gastric bypass was the most prevalent in the last 10 years, and it has slowly been giving part of the market share to the gastric sleeve. The gastric sleeve is the most commonly performed procedure nowadays. The lap band, which was very popular 10 years ago, has decreased. We are seeing now results that were not as good as we expected. So the lap band at some point in the last 10 years was about 35 to 40% of all the procedures performed. Now it's only like 3 or 4% of all the procedures performed is going away. We're not doing too many lap bands. And then there's another procedure that is called the duodenal switch, which is a very aggressive advanced procedure that is basically designed for the people that are extremely overweight. We're not talking about the 40 BMIs. We're talking about the 80 BMIs, people that are in their 600, 700 pounds.
Oh, wow. I know there's a TV show like that we all, when we're flipping channels as well. So that's where the weight kind of becomes something that could cause death in the end, right?
Well, even we like to think that when you're 600-700 pounds, it's deadly, and it is for many reasons. For the morbidities that it creates, the diabetes, the high blood pressure, but also because of the mechanics of your respiration. For example, if your BMI is very high and you happen to have a car accident, your mortality will be 2 or 3 times that of somebody underweight, because your body habitus doesn't allow you to breathe appropriately on a ventilator or to undergo emergency surgery that you may have to have. So it's a good measure of prevention, even for surviving an accident, to be in an appropriate weight. Now, when we have people that have the BMI of 40, which is not that extreme, it's the lower limit of where we consider patients to have surgery, still your life expectancy is 10 to 12 years shorter than your counterparts that are on their ideal body weight. So in a shorter or longer term, obesity is a deadly disease.
That is just amazing information. We're here with Dr. Fernando Bayron Hold that thought, Dr. Bayron. I'm going to take a quick break, and on the other side, talk a little bit more about bariatric and general surgery on the How to Stay Healthy show. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments. And my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hello, South Florida and beyond, because we could even be in space now with Elon Musk his Tesla in space. Maybe that radio station has got us on. Yeah, you never know. May need extraterrestrial life, may need some revision surgery someday. Well, but all kidding aside, we have a great program going here. Bariatric revision and general surgery with Dr. Fernando Bayron. Dr. Bayron, I have the unique experience of seeing the Da Vinci robot up close, and actually, I went to a demo last week. We were talking about. I actually got to drive it. Just a demo, but just fascinated. Now, this Da Vinci robotic surgical system, this is something that is kind of new to the media talking about this, but you yourself have done how many cases with the robot?
I hope that during the next few months I get to 1,200.
Wow, that's amazing. That's a lot of experience. And talk about a little bit about the Da Vinci. It's a laparoscopic robot, correct?
Yeah, the Da Vinci in reality, and that's funny because always patients, you talk to them about doing robotic surgery, they say, but who's doing the surgery, you or a robot? Well, the robot doesn't do the surgery. The robot is let's say it's an upgrade on the laparoscope. Laparoscopy is the surgery we used to do, or we still do a lot also, that allows you to go in through tiny incisions with scopes and instruments to do surgery. The problem was that laparoscopy is limited in certain aspects. The instruments are long and they're like chopsticks. They're straight. So if you have to get complicated angles in certain surgeries, well, the laparoscopy is tougher. Now, when somebody came up with the Da Vinci idea, since it's a computer interface between the hand of the surgeon and the instrument, it allows for those instruments to take all kind of rotations. They can go up, down. So they actually angulate in sharper angles and preciser angles than the human hand. So you're enhancing on the human hand. That's why it's so great, and it allows us to do very complicated surgery through very small incisions.
And you use your thumb and fingertips in the module to move the laparoscope?
Right. You use something that we call a haptic control, and is like controlling a hand control. It's not like a joystick, as you say. You use your 2 fingers and your wrist for rotation, and it has, I believe, is 270 degrees of motion in any angle. So it allows basically to mimic the movement of your hand inside of the patient abdomen, which is something that you cannot do with laparoscopy. And there are some cases where that is necessary.
And I can attest to this, listeners and viewers. I've actually attended a surgery that the Da Vinci was used. And like I said, I got to test drive it last week at Good Samaritan Medical Center in West Palm Beach. Now, Florida Medical Center, where you're the medical director of bariatric surgery, has the Da Vinci robot, but they also have another one. They have 2 Da Vinci robots, right? That's amazing.
We are such a busy robotic program that we had a problem of having a robot available for surgeons that wanted to come in and do the cases, because we were doing so many cases. So, of course, with the support of the administration and Tenet Corporate, we were able to get a second robot. Being this the newest technology, it's called the XI technology. So we don't only have the 2 robots, we have the very new, the latest technology available in robotic surgery.
Now, what other kind of surgeries are you using the Da Vinci for? Obviously, you're using it for bariatric revision surgery. Do you use it for the gastric bypass and gastric sleeve as well?
Yeah, we do it for all kind of bariatric surgery, gastric bypass, gastric sleeve. It is, for me now, I wouldn't do a revision if I don't have the XI. It's because the definition of what you see, I see better with the XI through the scope in the XI than with my own eyes. It enhances your vision. So for revision and bariatric surgery is great. And then with the other cases we do in general surgery, gallbladders, inguinal hernias, those are the simplest cases we do. And we do a lot of advanced, complicated ventral hernias. Hernias is a topic you can have. Not all hernias are created equal. There are very simple 20-minute outpatient procedures, but sometimes we deal with very complicated 2-3 hour major hernias, people that basically have lost the ability of the abdominal wall to hold the contents inside. And those cases by laparoscopy are almost undoable. But with the Da Vinci, we can do them.
That's amazing news. And I know by the time we're all adults, we've heard someone have a hernia or maybe even seen one. But actually, from a doctor's standpoint, what actually is a hernia? Is it a piece of the abdominal wall that kind of comes loose and pokes towards the skin?
A hernia, by definition, is a hole in the abdominal wall.
Oh, it's a hole. Okay.
Yeah, the abdominal wall, the skin and fat don't hold the contents of the abdomen inside. There's the muscle, and the muscle is covered by a very thick fibrous layer that is called the fascia. And the fascia has a defect, and that's what creates a hernia. In the inguinal hernias, the defect is in the groin. In the ventral hernias, the defect is in the abdomen. And they can happen congenitally. You can be born with that, or they can happen as a result of previous surgeries. When that fascia doesn't heal appropriately, then it creates a defect.
Yeah, and it pops out. And some of them can be very harmful to people's health if they're not treated right. There's some that could even cause death. Is that correct?
Yeah, because the problem is that when you see or feel a hernia, that you see what we commonly associate with a hernia is a bulge in the abdomen. But that bulge is not the actual hernia. That bulge is the contents of the abdomen, whether it's the fat or the bowels, actually poking out through the hole. If that bowel that comes out through the hole gets caught there and it swells, then the bowel stops receiving blood and dies. That's what we call an strangulated hernia. And that is a surgical emergency. If that goes untreated, you die of that.
Yeah, that's when it gets really complicated. So definitely check out Dr. Fernando Bayron if you have any of these ailments or interested in bariatric surgery to better your health. He's a general surgeon and bariatric surgeon with Tenet Florida Physician Services on staff. He's a medical director of bariatric surgery at Florida Medical Center. campus in North Shore and Fort Lauderdale.
And of robotic surgery.
And of robotic surgery, medical director of robotic surgery. And let me tell you, since we're back on the robot, that thing is so precise. People, I think robot's kind of the stigma, like, okay, it's a robot, but Dr. Bayron or whatever doctor's using it he's controlling it. And what it does for me, it just makes, like you said, so precise turns and 270 degrees that you wouldn't be able to do with laparoscope. And
no, it allows you to do things that are undoable. And also, I mean, it has advantages for the patient. Length of stay in the hospital is shorter because they get less tissue trauma, so they go home earlier. Pain is diminished, there is less bleeding. It also provides benefits for the surgeon. It's more ergonomic. We get to do complex surgery sitting in a chair as opposed to standing there for 4 or 5 hours.
Yeah.
So it makes your active life as a surgeon longer, protects your shoulders. You know, it's interesting. Laparoscopic surgeons, their occupational hazard is shoulder and neck injuries. They retire because of shoulder injuries.
From moving that laparoscope and trying to get those angles
that you have to do to get those angles. So one of the advantages for the surgeon of robotic surgery is that it protects your neck and shoulders. And it allows you to do more precise dissection because it's better. It has better angles.
I knew something was different about you when you came in today. You have a easier job with the robot.
I can do more surgery now in a day.
I know.
I'm not as tired when I finish the day.
No, you really do look great, though. It's hard to believe we wrapped up 30 minutes. Another reason the robot is great, smaller scars for the women as well. Yeah. Guys want to show their scars. Women want smaller scars.
Gallbladders, we actually, with the robot, can do through a single incision in the umbilicus. So the incision basically becomes invisible.
Well, thanks again, Dr. Bayron. You're always welcome on the program on the How to Stay Healthy.
It was great to be here.
Thank you. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests, and callers, and not necessarily those of